Hi, welcome back to BRMC's Healthy Connections. Here with us today is Tammy Mitchell, who is the director of the Baxter Regional Wound Healing Center, and we've been talking about those that are candidates to become patients at the Wound Healing Center, and we were talking just before the break about the hyperbaric chamber itself.
Yes.
So Tammy was going to give us a description of what happens when you come in as a patient to have a wound healed.
Yes. Well, first I will say that when a patient comes in, every patient is evaluated to see if they would be appropriate for hyperbaric oxygen therapy. Mm-hmm. And there are a lot of reasons, clinical reasons, that a patient might not receive that therapy. However, if a patient's going to receive hyperbaric oxygen therapy, it's a long, big, heavy, tubular piece of equipment. It's clear. It's an acrylic cylinder. That's what it is. And it has a door that opens on the end. There's a stretcher that slides in and out on rails. So when you come into the hyperbaric chamber, the nurse always checks your blood sugar, takes your vital signs, does a checklist, making sure you have on the proper garments, okay. And then you go into the chamber and the door is shut. When the door is shut, it stays shut, and the patient then is in there for their treatment during compression, the therapy, and decompression.
I'm going to stop you for just a minute. I'm not clear on this. Are they being loaded from the side or
from the end?
From the end. Okay.
From the end.
Okay. Now I'm with you.
Yes.
Okay.
And it's safe to say that you're sealed.
Okay.
In this tube. And the reason you're sealed is because the oxygen then is piped into the machine and it's compressed, so of course you're sealed. Now, you have a nurse sitting by your side at all times with a speaker with a little phone and headset that can speak with you. You communicate constantly. Mm-hmm. She watches you constantly. And patients sometimes think, oh my gosh, I'm in there, now I can't get out. And it is very true that you can't just walk over and open the door. It's compressed, it's under pressure.
Right.
So a patient must be decompressed to come out. So if a patient goes in and they're claustrophobic, the physicians many times will prescribe a mild medication for the patient to take prior to therapy. Okay. Because it's clear all the way around, you can see your entire room and surroundings, and you have a TV that's dedicated just to you. Janice can change the channel for you or turn the volume up or down to your level of comfort.
So you can get lost in a movie.
Yes,
and
take
really,
a nap.
Yeah.
Whatever. It's really very. The claustrophobia effect, while people think they're claustrophobic, many times
just goes away.
Yeah, it goes away once they go in.
Yeah, I've talked with folks too with the same type of thing with MRIs. Once they actually go through it, find that it's not at all what they thought it would be. Noisy, but now this has no noise to it.
This is not noisy.
This would be very quiet.
Very quiet.
And you mentioned the appropriate clothing, loose fitting.
No, all cotton.
All cotton.
A patient wears a hospital gown into the chamber. Prior to receiving hyperbaric oxygen therapy, the nurse goes over an extensive checklist with the patient on what can and cannot be worn. Certain types of body soaps, no lotions, no makeup, no underarm deodorant. Okay. And every day the nurse goes through the same checklist to make sure that you don't have those things on.
Now, is this to protect the equipment, or is
the patient?
The patient. Help me here. Not being a nurse, not clinical.
It's a safety measure because oxygen is flammable.
Okay.
And it's just precautionary to make sure that it's all cotton and there would never be any static electricity in the chamber.
Okay. I was thinking more with the lotions and the deodorant. They would clog pores of your skin.
Right.
So you don't want to do that. You want to be able to absorb the oxygen all the way through your breathing and body. Okay.
Right. But and that probably might have something to do with it, but it's the safety. And we are all about the safety.
Oh,
absolutely.
Sure. What else is going on? I know that every single arena of healthcare is moving forward and things are advancing and growing. What's going on in your world as far as with wound healing? What are some of the advances?
Okay, well, in wound care, it's an ongoing research. And Baxter Regional Wound Healing Center is extremely fortunate to be associated with the research done at Ohio State University.
Okay.
We also have access to the research being done in Miami. We have a pathology that's dedicated just to skin issues. It's called dermatopathology. Mm-hmm. We have access to that lab. So there are advances all the time. And people always want to know about dressings. What are the dressings that you use? Well, dressings are absolutely important, and we do use the latest and greatest that are on the market. However, it's not just about the dressing. Dressings don't heal wounds. The body heals wounds. Mm-hmm. So where the advances in technology come is how physicians look at a wound, how it's assessed, and what do we do to determine the cause for non-healing. We refer to that as the etiology. So if a wound hasn't healed, perhaps in 30 days, well, there's a reason. So is it infected? Every wound is cultured. Is it infected? What is the circulation around the wound? What is the history? How are your blood sugars? What is your nutritional status? Do you have any underlying disease processes? Rheumatoid arthritis, something that suppresses your immune system. So, and the wound is cleaned.
It's a huge intake assessment process.
It is a very large intake, and the first visit to the wound center is a long visit. It takes about 2 hours, and we always tell patients, when you come the first time, expect to have about a 2-hour visit, and that is because of the extensive history that's done. Also, with wound management, debridement, aggressive debriding of wounds, and what that is actually scraping away with a sharp instrument the tissues that have grown and have maybe slowed down, delayed, or stopped the healing process.
And is that done while a patient is there?
That is done at the wound center during their visit, and it is done by a physician, and it can only be done by a physician. So that, again, sets us apart from other wound care programs. While somewhat effective, not to diminish those, but ours is very different because you see, the patient sees a physician every visit.
Okay. Who's your medical director?
Dr. Kent Noctegal.
Dr. Kent Noctegal. Okay.
Yes. We have a panel of 7 physicians. We have Dr. Noctegal, Dr. Stahl, Dr. Spohr, Dr. Swarrier, Dr. Dickinson, Dr. Jamie Pritchard, and Dr. Michelle Godfrey. And each of those physicians covers a portion of the week. So
that's a very impressive list.
It's a very impressive list, and it's just awesome. And each of our physicians have attended 60 hours of continuing medical education on chronic wound care and hyperbaric oxygen. So we are very much specialists in our field. All of our nurses also attend the very same type of education. So that being said, when the patient comes to see a physician, we want to create continuity. We want to create a team. The team is the patient first, the physician, the nurse case manager. So the patient typically sees the same physician throughout their process of healing their wound.
Oh, that's wonderful.
Yes, it's very effective at progressing a wound. In fact, the national standard are for chronic wounds to heal 80% of the time within 16 weeks. We monitor that all the time, and right now we are healing our patients 86% of the time.
Oh, congratulations!
Within 16 weeks.
That's wonderful.
Yeah, we're very proud.
And that is that important, crucial piece is that continuity of care.
Yes.
That many discussions that we've had here with guests that are visiting that talk about just that, how crucial that is to have that continuity of care, to be seen by the same physician. The team is extremely well trained, and it's a team. It's a team working together with the patient. And
the goals are evaluated and discussed with the patient every 4 weeks. We have expectations for those wounds.
I was just going to say, expectations for the wounds and the patient as far as compliance.
Right. We tell the patients, you are the leader of the team, and it takes your commitment as well as ours to move this wound forward, to improve the quality of life. Wounds that have been chronic for a long time, maybe years, they actually inhibit lifestyle, quality of life. Many times patients won't leave their home for fear of leaking, draining wound, or maybe odor. And so it can affect their socialization. It just affects their whole lifestyle. So we tell them, we want to help you move forward, and we need your commitment and help.
I think this is one of the most fascinating portions of all of this, is that you can actually, within that, let's say that use 16 weeks as the example, take a wound that has been around, some patient has had for years,
Correct.
and actually cure it, or
Yes.
minimize it, or have a much better quality of life because it has been diminished.
Right, and there are many reasons wounds can be present for years, and I have a story that I tell, and probably a lot of our viewers who have heard me talk or have been to the wound center have heard this story, but it really is impressive. We had a gentleman who came to us, a veteran of World War II, had sustained an injury to his leg, and since that time had chronic wound problems.
Oh my goodness.
Years, 40 years. He had a wound that maybe might slightly heal but never completely healed. He had been a lot of places, to a lot of physicians, a lot of clinics, lots of places, not just Mountain Home. He wasn't necessarily from here. He came to us. He saw Dr. Michelle Godfrey. She took a look at the wound. She thought the wound didn't look correct. She did a biopsy. We sent it off. There was a malignancy there. Maybe the malignancy hadn't always been there, but it had become there because of the chronicness of the wound. Once the malignancy was found, it was excised, and his leg healed in 2 weeks.
Oh,
and he
my
saved his leg.
goodness.
His leg didn't get cut off. It wasn't amputated.
Oh my goodness.
And
what a wonderful story.
It's a phenomenal story. It's kind of amazing.
World War II. Wow.
Yeah.
Wow.
It's a long
Yeah.
time to deal with a wound
I
that
bet he couldn't believe it. He
he
probably
was so
just-
excited. And
yeah.
his family was very excited for
Yeah.
him, too.
Oh, I bet.
Yeah.
I bet. I mean, to go that entire time and not have something heal,
Yeah.
that's phenomenal. So,
We have a lot of good stories.
I
and
bet you do.
And I could tell a lot, but it's all about the team. Our doctors are very forward-thinking, very proactive, very advanced thinking, and they look ahead for these patients, and they talk about that with them. And the primary care physicians, we don't do primary care. That's not what we do, but we communicate with primary care physicians. So we send the primary care physician a report about every 4 to 6 weeks with pictures,
Okay.
telling them exactly what we did for that wound, what the progress has been, what the expectation is, so that when they go to their family doctor for a visit,
Everybody's in the loop.
everybody's in the
You
loop.
bet.
Again, continuity is
Right.
a big
Right,
factor.
bringing everybody into it.
Yes.
Tammy, how would someone reach you? Please give us that number.
That's 870-424-4935.
Okay.
We are located at 907 Burnett Drive. If you don't know where that is, you can call the phone and we'll direct you right on in.
All right. Tammy, thank you so much for joining me today.
Thank you for having me. I love to talk about it. I appreciate
I
it
can
very
tell.
much.
I just love it. Let's give our viewing audience that number one more time again for the Baxter Regional Wound Healing Center. Director here today, Tammy Mitchell, and that number is?
870-424-4935.
All right, Tammy, thanks again.
Thank you, Donna,
It's a
very
pleasure.
much.
Really enjoyed
pleasure's
having you
mine.
today.
Thank you.
I always learn so much.
Thank you.
Thanks for joining us. We'll see you again next week at BRMC's Healthy Connections.